Good day, my dear students. Welcome to R.A.T.S in Pathology. This topic is one of the first of mine. A case history. A 50-year-old mountaineer was caught in an avalanche and rescued after a few days. On examination, this was seen. So, I find that there is a normal pinkish hue of the palm, whereas the digits were having a blackish color or a discoloration. Also, there is a little bit of stiffness that could be appreciated in the fingers. Your diagnosis and your differential diagnosis. Gangrene is the diagnosis. So, this is a university question. It can be an essay, part of an essay in pathology, surgery, and definitely it will haunt us in viva. Gangrene is defined as death and mass of a tissue with superadded putrefaction. N mass means almost in total. Look at this one. The entire lower limb is affected. It is a below knee amputation. The gangrene itself can be divided into a dry gangrene and wet gangrene. These are the two basic things. The other things, don't confuse them with these. Fundamentals will be dry and wet. Now, what am I seeing in this picture? There is an amputation. Okay. There is an edema of the leg that could be appreciated, both at the heel as well as here in the plantar region as well as over the dorsal region. Also, I am finding some kind of a disc formation or a descaling. I will not be calling this an ulcer itself, but then it has been there. So also, I find that the edema is extending up to the upper part of the leg. That is why the surgeon had gone in for a below knee amputation or even a disarticulation of the lower leg. This is another case. In this also, there has been a surgical removal. They have removed the toes and then part of the foot. But what I'm saying is there is a discoloration. And along with it, this area appears a little more healthy than its counterpart over here. But I'm able to see some kind of a folding. And there is also a grayish hue over here. That is why the surgeon has hastened to make a amputation at this region. This is called a dry gangrene. A dry gangrene is one which is mummified, just like an Egyptian mummy, shriveled, shrunken, folded, etc. And it can happen in a number of conditions such as the R.A.T.S disease, the case history, any ischemic trauma, ergot poisoning. This is a contaminant in the bread, etc. Anum, it is an auto amputation of the digit. Thromboangiitis obliterans, a vasculitis. So there are a lot of conditions which people will have to mention. A dry gangrene. So these are the features of it. Dry, wrinkled, mummified, demarcated, grayish black. Not very foul smelling because of a limited amount of hydrogen sulfide. Look at this. This is called a volvulus of the intestine. This is a loop of the intestine. There is a mesentery here, and making use of the mesentery, the loop has twisted around itself, creating what is called a volvulus. This also is over here. And in the process, you find that there is a retention of the venous blood. It is developing a bluish tinge. the normal arterial blood is not able to enter. As a result of which, there is a deoxygenation and there is a gangrene that is developing over here. Now, what are the examples for this? It can be a volvulus of the intestine as shown, a strangulated hernia, same theme. So, it is almost like strangulating a person in the neck. Intersusception, there will be a picture for it. Venous compression, stasis. In all this, there is a blackish discoloration because of the hemocysteine pigmentation. And the hydrogen sulfide, it produces a foul odor. Look at this one, a ballooned out loop of the intestine, which the surgeon is hastily removing from the abdomen. He is quite careful, it should not burst. This is the mesentery that we are talking about. Had he not done this, it would have been somewhat similar to this. It is from another patient, and here I find that there are the loops of the intestine which have developed a blackish discoloration. And look at these blood vessels. They are all the various arcuate branches of the mesenteric blood vessels. The veins get compressed and the venous blood cannot be drained, as a result of which arterial blood cannot enter. Blackish discoloration, there is edema or swelling, it appears shiny, no definite line of demarcation. This is yet another example. So this is the testis and this is the cord. What happens if it is going to get twisted and twisted? All these structures will be compressed and the veins get compressed more. So also the same thing can happen in a ovarian torsion. So this is the testis, the epididymis is over here, and I find that it is developing a blackish discoloration because of the stasis. So it is a gangrene testis. And the entire cut surface. So there is a stasis. Look at this venous hemorrhage, and the whole thing has become gangrenous. It is not viable. This is the volvulus, whereas this is the intersusception. Intersusception is a loop within a loop. Here I am finding that there is one loop of the intestine going into the distal loop. This will usually happen when a patient recovers after an anesthesia. There is a rapid peristalsis of the proximal loop going into a static distal loop, producing an intersusception. So these are the blood vessels. What will happen is at this particular rim region over here, there can be a compromise of the blood vessels leading to a gangrene. Once there is a gangrene in one region, it can spread along the sheath. Now, what are the differences between the dry and the wet gangrene? Dry gangrene, more common in the extremities. Wet, both in the bowel as well as the limbs. A diabetic limb is a classical example. Please do not forget diabetic limb. It is an exception. It is a wet gangrene in the extremity. Mechanism for a dry is arterial occlusion. Here it is more of a venous occlusion. The examples we had seen: torsion, volvulus, strangulation. Macroscopy, it is mummified, dry, shrunken, shriveled. Whereas here it is edematous, tense, soft, swollen, dark. No definite line of demarcation is seen in a case of wet gangrene. Putrefaction is minimal because of very little blood supply in a dry gangrene, whereas it is marked due to stuffing of the organ with blood. Bacteria lesser in number, there is a dense proliferation. Odor is absent, profound foul odor. Organs we have already mentioned. Here it can be testis, intestine, ovary, etc. Causes can be for athiroma, Burgess disease, TAO, Raynaud's disease, ergot poisoning, A&M is one. A&M is a condition where there is a gradual narrowing of the root of the digit and it gets auto-amputated. The prognosis is generally better and treatment for both will be an amputation. The prognosis is poor in the case of wet gangrene. Please by heart this. Now, look at both these pictures and enumerate the differences. I would like you people to go back to the list that we had given and find out at least 6 differences between these two pictures. This is a Fournier's gangrene. It can happen in the scrotal skin. I find that the part of the penis as well as the scrotal skin, they are all becoming gangrenous. So This is because of a necrotizing fasciitis. So a fascia becomes necrosed and it spreads. There is nothing to control it, no borders. Sometimes there can be a stomatitis, so in the mouth, etc., and it spreads to the oral cavity as well as the para-oral structures such as the cheek. This is yet another type, the gas gangrene. The gas gangrene is more or less like a dry or a wet gangrene, but then there is a production of gas by the bacteria. So in this, the Clostridium tetani, botulinum perfringens, or the noe, edematians are there. Look at this patient. There is a markedly edematous thigh and it is spreading. There is no demarcation over here. If they do not take the necessary steps, it will keep spreading along the fascia. It produces the alpha and the thecotoxins, these bacteria, sepsis. Death is imminent if not treated. So there will be dark bubbles of air over here. And when you palpate, there will be the crepitus. In fact, we are not supposed to palpate because that will be dislodging the infection. And a foul smell is also there. It is a gram stain. Crepitus is positive. X-ray also will be showing a plane of air. Debridement is the treatment of choice and hyperbaric oxygen should be given. Please by heart this. So this is a null story. You opened a tautopsy and you are finding the loops of the intestine. I would like you people to kindly compare the viable and the non-viable areas. And look at the clinical picture of the patient before opening it up. Some people are so afraid to die that they never begin to live. Henry Van Dyke. Thank you again for your listening.